19th, 2020 Executive Committee for the Poverty and Homelessness Board. I'm Chris McAllister, Chair, and would like to have people go around and do introductions, and hopefully Noreen will pop in, and we will go right into the introduction of Lane County staff after that.
Okay, I'll kick it off. I'm Lucy Venice, Mayor of Eugene, and I will kick it to Pat.
Pat Farr, Board of Lane County Commissioners.
Sean Ashworth, Health and Human Services. Sean Van Gordon, Springfield City Council.
And anybody else?
Steve Manella, staff.
Thank you.
Michelle Hankus, Shelter Care.
Red Johnson, staff, City of Eugene and Lane County.
Dan Brandt, Square One Villages, Observer.
Hi, Tim Black, St. Vincent de Paul, Observer.
Erin Fifield, City of Springfield staff.
Reagan Watches,
County staff.
Reagan Watches, City of Eugene staff.
Catherine Hunt, Backhouse Observer.
Welcome, Noreen. We're just doing the introductions.
Hi, Chris. Noreen Dennels with United Way.
Excellent. Just a couple more people.
Deanna Strawn Wilson, Lane County Observer.
Jacob Fox, Homes for Good Observer.
James Yule, Lane County staff.
Awesome. Anybody else before we kick this off?
Dana Davison, Lane County.
Diana Aldridge, Lane County staff.
Lisa Stewart, Lane County staff.
Well, thank you. I see all muted mics other than mine. So let's kick this off. Thank you everybody for being here this gray Thursday afternoon. May we please go over our minutes, our consent agenda, and get a motion to approve in a second? Or any corrections?
I move we approve the minutes.
And I second.
Moved by Mayor Venice, seconded by Noreen Donnells. All in favor, say aye.
Aye.
Any opposed, say no. Hearing no, ayes carry it. Thank you. Going back to the agenda. Lisa, wait, we did introduction of the Lane County staff. Laura Ashworth. Is that housekeeping?
Hi.
Yeah.
Yep. Sorry,
Awesome.
I'm finding my mute button. I'm Laura Ashworth. I'm the housing and supportive. I always get this wrong. Homelessness and supportive housing program supervisor for Lane County. Always feels like a tongue twister. And I am happy to announce that we have 2 new positions that we have hired for. And I believe one of them is with us today. I'm not sure if the other one is, but the first one is for a shelter and alternative shelter coordinator. So they'll be taking over all of the contracts, planning, program planning in collaboration with Amanda Borta as our COC lead for all of our existing shelter and alternative shelter programs and for the ones that we are working on standing up. Her name is Catherine Ryan. She has a lot of experience working in nonprofits in our community. Many of you probably know her, and she managed some shelter programs and some other relevant homeless programs, and then went and worked for the state legislative office for a couple of years. So we're super excited to have her. She has hit the ground running. She's amazing. If you do see her, I don't believe she's here today, tell her hi and give her a warm welcome because we want her to stay and feel very welcome. And then our second position is a outreach and access coordinator. And so that person is really over the coordinated entry system, as well as our coordinated outreach efforts that we're putting together. So that will be case conferencing, that will be trying to coordinate sort of jurisdictional coverage with street outreach, making sure we have full coverage, coordinating best practices, standards, ways that services are delivered to try to help us as a system get a little bit more streamlined. And then also working on the, TAC recommended improvements to the coordinated entry system and a whole bunch of other things in there as well. And that person is James Ewell. He is on the call, and James has many, many years. I never know if I get the number correct, James, but somewhere in the ballpark of 15 years experience in homeless services, working with Looking Glass and doing outreach and managing outreach programs and shelter programs. So we are so excited to have them both, and please help us in helping them feel welcome.
Thank you, Laura. Thank you, James and Catherine, for being part of the team. Feel like I've known some of you for a long time. So glad to have you working with the county on these awesome opportunities to build up. So James, do you want to just say something for a quick minute?
Hi there, everyone. Happy to be here. I think I've met several of you previously in my past work life, so I'm glad to be a part of this, and thanks for the welcome.
Excellent. Is Catherine in here too? Does not appear so.
I don't believe she's on the call today.
Excellent. Well, thank you very much, Laura, for that. Let's go into committee updates. Commissioner Farr, would you like to speak on shelter stakeholders?
I can. Thank you very much, Chris. And many people know this, but not everyone perhaps, that committee has morphed through the past 7 years, began as the Veterans Housing Committee, Operation 365, and became the Shelter and Supportive Housing Committee. Most recently, its recent iteration is a Shelter Stakeholder Committee with an expanded roster of members. I have been the chair of that committee since its inception. We on Monday, the next committee meeting, we will be selecting a new chair for that committee to take over beginning in the new year. We have 3 nominees for that position. Chris McAllister is one of the nominees. Kristen London is a second nominee, and a third is also with us today, Dan Bryant. On Monday, we'll be voting on that position, and I'll be discussing. The agenda will come out as far as the position in the agenda of the voting for that position. Probably will be toward the end of the agenda. That committee is a very robust committee filled with people who have, if we added the years of experience in service toward poverty and homelessness in our community, it is highly impressive. People with lots of experience, lots of expertise, lots of policy advice experience, and also representing multiple jurisdictions. The future of that committee is bright in terms of the amount of work ahead of it, and it's also bright in terms of the staff support that it receives and will receive, and bright in terms of the agendas that it will be forging through. So look forward to announcing a new chair this coming Monday. Thank you.
Thank you, Commissioner. Kirsten London, Dan Bryant, and Chris McAllister for the possible shelter stakeholders chair. Healthcare Committee, do we have Dr. Kincaid or someone from that committee available? Hearing none. I know that the 3 active action groups have been working on care coordination, on emergency respite, shelter options, and just trying to problem solve with both COVID and the complex needs of our unhoused folks. So I know that Dr. Kincaid spoke last time, and so we can check in with him next time. Is anyone from the youth solutions work group? Seeing none.
I can give an update as staff, Chris. This is Amanda.
Okay.
So they did meet last week or the week before, can't remember anymore. And we really focused on talking through the emergency solutions grant funding, potential concepts, getting some input from that group on how to move forward on some of those items. And we've also gotten some youth direct feedback as well. And that group is also discussing sort of how to move forward with their meeting time, and their membership. And we might have a change of, we do have a change of co-chair. So Deborah Daly will now be the co-chair of that committee to help out Susan, who has had less capacity in these COVID times and managing at home teaching of her children as well. So so I think that's the only update there. And then moving forward, we'll probably be focusing on the youth homelessness demonstration program whenever that NOFA gets released.
Thank you, Amanda. Let's see here. Deanna, would you like to talk about employment?
Chair McAllister, did you skip league or are you coming back to that?
I was going to come back to that.
Perfect, thank you.
I can. The committee hasn't met since, let's see, we met in October, but I think Dave did report out in October. And we continue to have guest speakers coming to talk to us about different supported employment programs. In October, we had Heather Salicki come and talk about city shelters, tents. I'm not ready to deliver. I'm so sorry. She was working with a professional commercial tent builder to create a design for disaster relief tents. And we also had Mitra Gruel from Discard Upcycling give a presentation, and they were able to make a connection. And I believe that that tent is now being produced at the location where Mitra has her makerspace. So we just continue to gather information about what's happening around the county as far as employment goes. That's in my unprepared state. That's what I can share.
Well, thank you very much. Amanda, would you be willing, as I missed part of the league meeting, to give a quick update about league?
Sure, I'll have to refresh my memory now. There's been a lot of meetings. Danielle gave a presentation at that meeting on the new PSH project to get some feedback. That's the 1100 Charlton project that's in the works for development. So League was able to hear about that and give some input on that project. There will be more opportunities as we develop kind of details similar to how we did with MLK. We also gave kind of a general standing update on winter strategies and sort of the work there, and we'll talk about some of that when we get to the funding and planning updates conversation and current challenges. So we spent a good amount of time on that. And I'm not sure what else we had on the agenda. I think that's all I can remember.
Well, thank you, Amanda. I know that League is still working on some of its reports with the re-implementation of a pause for COVID that has a lot of people concerned, and with winter strategies upon us even earlier than normal. There's been a lot of talk about what's available and what's out there. And so as we move forward, I know that League is looking at having some focus groups and engagement opportunities to try and reach out and have the lived experience voice heard as we look for places in Springfield, in the fire zones, and in the greater area of Eugene as things have wrapped up with the holiday fire, but the people are still displaced. So thank you everybody who's been present in those conversations and helping do that feedback. I know League looks to have its report done by the December meeting, but ultimately time will tell.
Chair McAllister, may I insert on League?
Yes, sir.
Thank you. At the Human Services Commission meeting on Monday, we had a discussion about one of the main tenets of the TAC report, and that is more complete utilization of an existing shelter. And we've always had the discussion, why do people choose to not use shelter, choose to remain sheltered in tents or other substandard means of shelter? And we have, through the years, anecdotally, we've received some information about it, but Lisa Stewart had a suggestion, and Lisa's here. Sorry to spring your suggestion out loud, Lisa, but Lisa suggested perhaps a focus group where we invite in separate and smaller confidential groups of people reasons that they choose to not use shelter, and actually get a compilation of the reasons that people don't use shelter, and see if we can find any themes there and begin to address those needs. The reason I brought this up during this conversation, Chris, is that League was mentioned as a potential convener of the focus groups. And you know, and you and I have talked about this, that people often like anonymity, and focus groups don't always provide a level of anonymity. And we would have to find ways to make certain that people feel secure in presenting their information, that they're not going to get expelled from wherever they may be staying. So that's just to throw something forward. And Sarai, perhaps during your report later, we can talk about it a little bit, but I intend to add this to the agenda for the Shelter Stakeholder Committee meeting for Monday.
Can I,
Thank you, Ms. McCall.
Chair, can I really appreciate that thought, because we had heard that at the city council this week about that HSC conversation. I also, given the investment in outreach, and there's a new outreach coordinator, I'm wondering if that can't, instead of convening focus groups, can't be a sort of a part of various outreach teams, just keeping track of that kind of, sort of in an intentional way, asking that question when people say they're not interested, why, rather than trying to go through. So we can talk about this further, as you say, Pat, at the Monday meeting, but just a thought that this might be a good way to piggyback on existing outreach work.
I do think we have wonderful and probably very effective ways to reach out. One thing that I like is to gather a body of actual quotations that I can say, such and such person said exactly these words, so that we're not talking about my interpretation of what they said, that it's actually a quotation. I love to do that, and people who've been in meetings with me quite often find themselves being quoted by me.
I think those are both very valid points, and I think that a synergetic approach, having both the focus groups and the outreach work, can help us carve out what is the truth as best as we can find. There are plural realities for everybody in the shelter needs and in the capacity needs, and so I feel like both are great topics for the Shelter Stakeholders Committee meeting, if Mr. Chair agrees. And
thank you, Chair McAllister, Mayor Vinnis. Thank you, and Sarai, thank you.
Excellent. Well, that wraps up what we have as noted committee updates. I'd like to move forward with Lisa Stewart and Dana Davison, please, on data and analytics.
Hi, everybody. This is Lisa, and Dana is with me too. This will be quick. I'm afraid that many of you have already seen this, so I'm going to try to be brief so you can get into the rest of the agenda. So this is our homeless by name list report. So it does not have any client information in it, just a reminder, but it does summarize what we're experiencing month to month in our community. What we're looking at here is on the last day of October. So this is the October report. There we go. And I'm just going to cruise down to the bottom of this report to show you the trends. You have seen this information before. The trends are actually following the same as last year pretty consistently. What we're looking at for the last day of October is 4,155 people are experiencing homelessness in Lane County. Last year it was 4,262. We had hoped with the interventions that we have been crafting, we would have seen a more bend. But I believe with the pandemic, the wildfires, all the other issues that we're also dealing with, it is resources have had to shift around because of that and have not been focused entirely on the homeless population, which is not surprising. I think every community with these issues is dealing with the same thing. We did see a decrease here in April and May, which can be explained pretty easily by agencies, provider agencies, having reduced staff and at that time figuring out how to open their services back up in a safe way for their staff and for clients. And it looks like they've figured that out, and here we are back on track. I will post the link in here for everybody so you can go. This is public. Everybody can go to this now, and it's in the chat. You can go to the link and check out these data yourself. The other thing I wanted to share with you is something that will be new and coming down the pike. I want to show you, excuse me. We're going to be having, Dana and I have been working on this about the average monthly utilization of all of our housing inventory that's designated for homeless persons in Lane County. And if Dana, can you walk through what we're looking at as far as what is average and what people are looking at, for example, on this rapid rehousing screen?
Yeah, so we're going to be able to see at the end of each of the bars, for example, the 209, that is going to be the total inventory, the average for the month. So one of the things that we used to see this data as a point in time on a specific day in the month, but now we're really looking at it and being able to update it on a daily basis. This is going to be the average for the month. So if inventories stay the
I'll go
same,
over to the transitional that actually has an inventory. That'll be more helpful.
that will make more sense. So the inventory that we have marked in HMIS, if that inventory changes halfway through the month, it will take the average for the number of days in the month that say the inventory was, if it was 57 for 12 days of the month and then 70 for 18 days, it's going to average that for the number of days that each inventory was available. Now, if the inventory stay the same for the entire month, then it will show what those inventories are. So it's rather than being a snapshot in time on a single day, it allows for us to really look at the averages over the month. It also does the same thing for utilization. So utilization is the number of people who are actively enrolled in the program, and it looks at each day. It goes and does a count of the number of people that are enrolled. And one of the things that's really great about this report is that if we notice that there's some issue and we go in and fix it, it will update retrospectively. So say the inventory should have been changed for a specific product or project last month, but it didn't get changed and we realize that, we go back and change it and put the date for last month, it will change the inventory going back. So last month will also get updated to the correct data as well as for this month. So this really does allow us to do that data cleanup piece, really see it in time, go in, make the changes, and then have it be updated. I'm not sure how often we're going to be updating the public version of this, the one that's live inside for internal facing for Human Services Division in Lane County. We'll update every day, but we'll have to talk about it because it's a couple extra steps to be able to update the public version. So once that's decided, we will make sure to indicate that on the information page about how often this is updated, and maybe even have a call out to saying this data was updated on this specific date.
Thank you. One of the neat things that we're able to do with this is really include all the inventory of Lane County, including the alternative innovative solutions that we have put into place that are not emergency shelter as far as HUD thinks, but they are solutions that our communities put into place. So they're extremely valuable. And so we want to include that. So we are able to do that in a way that looks and feels just like standard emergency shelter. So we'll be able to look at these alternative projects like the Opportunity Village or Dusk to Dawn, the overnight parking programs, and take a look at how those projects are being utilized on an average per month.
And I want to call out one more functionality. Once this is published, you can see there's like a blue underline that says click on the project to see the monthly averages below. Lisa, if you scroll down so that they can see the bottom, at the bottom we have the trend over time, And if you click on a specific project, that will filter down so you can see the it should filter down and show the monthly trend over time for that specific project. So
so this is Dusk to Dawn now, where we did have a year ago, it was 192 beds. Then we did a big expansion. Oh no, COVID happened. We had to drop that way down for safety protocols in the facility. We had to drop it down even a little more. But so we can see this total inventory of 256 dropping down to 110, which is an average. Next month, you'll see it as 105. And the utilization of that, which consistent for Dusk to Dawn, it's usually pretty full. And then if you click back on there, you can see it for all these program types throughout all the years at the bottom with the monthly averages of how we're using these alternative, innovative solutions.
Excellent. Thank you, Lisa. Question for you. I've been playing around with this list a little bit to try and understand our needs. I was curious, is there a way to report language needs, people who may need either Spanish or sign language or whatnot, as we have several pockets of that population in our current group?
Yeah, so we do collect that information, and on the preferred language of the client, what they would want to receive services in if they had that preference.
Okay.
So we can include that in our homeless population data.
Okay.
It hasn't been done yet just because you know how things are now. It's like there's a laundry list of stuff we need to get to, but that is definitely on our list, Chris. And thanks for that idea last week that you floated. I thought it was great.
Excellent. Thank you for that. And do we have ability, given that we just had the shelter thing that's about to go live, do we have a way to have like a provider by name list so we know how many people in our community are able to speak Spanish, are able to do peer counseling or things like that? So we understand not only what do we have as a need, but what do we have as capacity?
Yeah, I hear what you're saying.
Okay, cool. Well, thank you for that.
Can I ask a quick question, Chair?
Yes, ma'am.
So Lisa, can you go back to the slide before this where you had
there we go. The
utilization slide? Yeah, I'm particularly interested in the overnight parking and the safe parking. It's a little discouraging to me that when this is such a need. So I just want to double check when that, in terms of the singles overnight parking, 27, those are individuals, correct? Not households. Like if there's a couple.
These are individuals.
They're individuals. So it could be fewer households that are.
Well,
that's singles. So that would be true for the safe parking, maybe could be.
Safe parking is almost all singles. I mean,
Almost.
it is singles. There's no families in safe parking.
Yeah, I mean, given the number of people that we have camping in our rights of way, it would be pretty critical to understand why they're not availing themselves of the overnight parking. So thank you.
Sure.
I agree with Pat Farr. This needs to be a conversation at the shelter stakeholder meeting. That's worrisome, really.
Well, in safe parking now, we actually have 4 more people than the inventory. So they're making it work over there by doing some overflow. That's what a negative number is showing us.
Right.
But yeah, there are some, and Dusk to Dawn, I think we'll see a little course correction in this because there was some issues there this month, and probably by next month, fingers crossed, we get back up to the 105 filled beds. I would not be surprised if that's already it's already starting, but.
Yeah, this is just so incredibly helpful, this snapshot.
Oh, good. I'm looking forward to being able to get it out to y'all in the public view, so we can start to make those adjustments to the report so you can use it the way that makes most sense to you. So there's no end. There's never a final report. There's always a report that's waiting for the next improvement. So
Super, thank you.
yeah, thank you.
Excellent work, Lisa and Dana. I was curious, since we were playing around in the back end of the server, is that why there might be errors out? I was trying to run some numbers real quick while you were talking, and I've gotten server errors.
On which on the to look at the Tableau site?
Yes, ma'am.
Well, I will well, Dana would have to figure that one out.
So Chris, you're coming in from the public view, correct?
Yes, ma'am.
It's really hard to say because it's Tableau public. That is like the actual massive Tableau public sites. So it would just be a slight glitch in whatever's happening with Tableau. It's used worldwide. So it's really a platform that we put de-identified data onto. So if we just do the aggregated number, so we don't have any control over that. Usually they're really quick about getting it fixed. So you should be able to just kind of refresh and do that. But we don't, everything that's published on there, nothing you or I will do will affect that.
Awesome. Well, thank you very much.
Yeah.
Any other questions for Lisa or Dana on this topic before we move on to the coordinated entry policies with James? Seeing none, James, it's your floor.
This is Laura. I'm actually going to present on the updates, and James will be here to answer questions along the way. Today, the specific updates that we want to talk about are the written standards for our hotel, motel, temporary emergency beds, and the prioritization and referral processes as it relates to those. And so we're hoping to run those by the group and get those approved or get feedback if needed so that we can get those standardized. Would one of the organizers be willing to allow me to share my screen? Thank you. Okay. We'll try to make this bigger. I'm fighting a little bit of a cold, so I may have to mute and clear my throat a little or take a sip during this, so please forgive me. So I don't know if everybody here is aware, but we have put into contract and are in process of moving forward with, or they have already opened, I think there's a variation, of 45 motel beds, 45 motel rooms at the University Inn with the contractor St. Vincent de Paul, who's operating the hotel, and then 21 non-congregate temporary emergency shelter beds through 2 agencies, one being Carry It Forward and one being Shelter Care. And those beds are going to be prioritized for people who have a higher risk of COVID and are literally homeless. So we're looking at single adult households, no minor children, who are literally homeless and who are at a higher risk of COVID due to per the CDC guidance, which we'll get into in a second. Does anybody have any questions about those projects before I jump into sort of the prioritization and referral process for them? Okay, I will move on. If some come up, please put them in the chat. So, like I mentioned, the eligibility and target population for these beds is single adults, so households who are over 18, up to 2 adults without children, and people who are literally homeless, so per the HUD definition. And within that, there is a prioritization layer where we're looking to prioritize people who are at higher risk for COVID-19 health complications under the CDC guidance. I should also mention that these projects are being funded, the services for them, through ESGCV. And so this is also a requirement of the funding to have this be the target population and the prioritization layered on top. Okay, so per the CDC guidance, people who are at higher risk of COVID include people who are, I think they fall into 3 categories? There are 2 categories. One of them is 65 years of age or older. And then the second one is people who have specific health conditions. And we'll get into the health conditions in a minute. But as we layer the prioritization later on, just remember that there are sort of two categories. There's A, which is age, and B, which is health. And so if somebody is 65 years of age or older, and or they have blood disorder, chronic kidney or liver, compromised immune system, high-risk pregnancies, pre-existing chronic illnesses, there's a whole list here: diabetes, heart disease, lung disease. I think we've probably all been really familiar with these at this point if we ever watched the news or opened the emails from Oregon Health Authority. But we anticipate that there's going to be a higher number of people that fall into these prioritization categories than there are spaces for people. So we have consulted with Lane County Public Health to determine a prioritization structure within those sort of guidelines. So the first one, the highest priority in category 1, are people who meet A, the age group, also people who meet B, the health condition, and who specifically have heart, lung, and kidney disorders, because per public health, those are the disorders that seem to be most at risk for serious or fatal complications of COVID, and who are living unsheltered. So that is the group that will get the first priority for these beds. The second group is people who meet age, the chronic health condition of any kind, and are unsheltered. Third is either age or chronic health condition and unsheltered. And then fourth is where we start to get into moving people out of congregate shelter. So if people meet age and chronic health condition and they're living in a chronic or a congregate shelter, so they're particularly vulnerable in the situation that they are in, then those people will be moved per category 4. Fifth is one or either age or chronic health condition and living in a congregate shelter. And 6th is pretty much anybody else who is unsheltered. So somebody who doesn't particularly seem to be at risk but is unsheltered. So really what we're trying to do is the people that are on the streets that are the most at risk, get them out first, and then start looking at our congregate shelters. And then if there's any space left, people who are on the streets who are not at higher risk of COVID complications, then that's the group that we would go to. Any questions or comments on the prioritization before I get into the referral process?
Is there any room or consideration for people who are actively in recovery, having just got off of drugs and are trying to be in the positive shelter needs? Because a lot of people who are experiencing that have weakened immune systems, weakened behavioral and mental health supports.
I think that's a really good question, Chris, and it highlights the gap that we definitely have in our community, one that I know you have seen and your team has seen firsthand, and one that continues to need to be lifted up. I will say with the purposes of this funding, because this is ESG, COVID specific funding, that the focus is really on people's health vulnerabilities. And I will say that with HUD funding, and Amanda, you can step in if I misspeak here or you want to add, it's a little bit more challenging to layer in more nuanced prioritization for things like recovery. I think one, because sometimes that can be subjective, and two, because a lot of times, well, not a lot of times, I mean, HUD funding, without going through really specific sort of application processes for specific types of funding, tend to shy away from streamlining the prioritization for these smaller categories, especially when it means that people have to be sober or active in recovery. So it's kind of the flip side of what you're saying, Chris. You're saying that people who are in recovery need a safe place to go, and HUD is sort of saying you can't require people or prioritize people who are sober to get in, because that leaves out people who are not ready yet. Does that make sense? Or does anybody, Amanda, Commissioner Farr?
Thank you, Laura. My question's on a different line, so if you want to exhaust this line of questioning first, I have a slightly different approach for Mr. Chair.
Okay, we'll come right back to you. Amanda, do you have anything that you would add to that?
No, I'll just say that the guidelines that we have here that you have just above on the screen are really taken from the groups that are outlined by the CDC as being at most high risk, and they're certainly might be others who are at high risk, but we, our guidance was to just sort of take that from CDC guidance and how they've outlined who is at most risk of COVID-19, which is the intention of this project. So that's where that comes from.
Thank you, Laura and Amanda.
Thank you. Commissioner Carr? I think you're muted.
I wasn't muted and I muted myself. Thank you, Chair McAllister. Laura, could you scroll up your screen just about a third of a page?
Mm-hmm. So we're going to go on to the other page. Would you like to do that?
Let's see. No, that's good. Just a quick comment. Last week at the Board of Commissioners meeting, we received a synopsis from our medical officer, from Dr. Lidke, on the rollout of vaccine. And I don't know, Laura, if you have anything that you want to say about vaccine, but he gave a very brief, albeit one shot in time, synopsis of what we might expect from a rollout of the vaccine. And if you have something on that, you can cover it. Otherwise, perhaps later in the meeting, I could just give about a 1-minute presentation on what Dr. Lidke has told us regarding.
Yeah, I definitely don't have any information, via our internal public health on a vaccine, but would love to hear any updates. So if you wanted to talk about them a little later, that would be great.
And please continue. And if Mr. Chair, Chair McAllister, if you'd like me to cover that ever so briefly someplace down the agenda, I can do that.
Yes, sir. If we have time, let's do it after Sarai's current challenges update, if that's okay. Excellent. Thank you.
Thank you. And I do want to highlight that Amanda Vorta put in the chat that these conditions are self-reported and do not require documentation from a licensed medical provider. So we're trying to be as low barrier as possible. Okay, I will move on to the referral process. If there's any other questions regarding the prioritization, feel free to put them in the chat and then we'll try to address them time permitting, or I can follow up with you on the side. So let's see, where were we? So for referrals, we have put together Lisa and her team, Lisa Stewart and her team developed a Cognito form, which is really exciting. It's something that her team has been bringing forward for a while with our rent relief and things like that. So it's a very user-friendly web-based form that allows us to pull out reports, that makes it very user-friendly for community members to access, and then has the potential, which we're still working out, to possibly communicate with HMIS. So lots of good things with Cognito. I think you'll hear that again. But we have a web-based form that is designed for providers to make referrals. There's nothing that precludes a client from self-referring, but we are in our marketing and in our design building it for providers to make referrals for folks, or support providers in making referrals. And the purpose of the form is to collect the information needed to create or update a client HMIS record, which would be needed for them to go into these projects, to determine what category of prioritization their referral falls into based on the criteria above, and then also to determine any special accommodations the household might need. So particularly if we're looking at ADA accommodations, we have a limited number of ADA compliant possibilities, so we want to make sure that those get prioritized for folks that need them. Upon review from Lane County Coordinated Entry staff, so right now James Yule will be managing referrals. So after he reviews them, then he will make the referrals in shelter points via the same mechanism, same type of mechanism that is used to make PSH referrals. So the referral goes into the system, the agency gets an alert, they accept or deny the referral, and we have that feedback loop and reporting mechanism built into that. When the temporary emergency shelter has an opening and they're ready for referrals, a staff will send an email to James. This may or may not be the best way. It's our best thinking right now as we continue to evolve the process. But for now, they will send an email to James, which is again similar to the way our centralized waitlist receives referrals. And then James will go into the system, or whichever designated Lane County staff, and then make that referral via HMIS. We're asking that the number of referrals do not exceed 3 times the number of current openings or anticipated openings. Typically, with PSH or transitional housing, rapid rehousing, we ask for 1 referral at a time. but due to the high turnover of this, potentially high turnover and time to sort of fill these beds and the emergency nature of these beds, where we're going to try out going up to 3 referrals at a time. So if they can't get in touch with somebody, they can go back on the list and then they can move on to the next so that that bed doesn't sit open. We really want these beds to be utilized to the fullest extent possible throughout the winter. What else? So we are asking the agencies managing these beds to let us know the outcome of the referral within 72 hours and any reasons that a household has been denied. If they are determined to be ineligible for the specific program or the program is unable to locate the household. So we really want to know, is it that you couldn't get in touch with them? Is there a reason that they're ineligible per your eyes so that we can talk through that? You know, make sure that our policies and procedures for the program reflect that, and that within 72 hours, this is a typo. I'm going to take this 2 weeks out as I'm seeing that. That within 72 hours, they let us know the outcome so that we can see if we need to make that referral for a person to another opening or not. Any questions? We're hoping that you all can either give us your feedback, ask us your questions that are needed to take another stab at this and get it finalized, or that we can get this approved by you all today as an addendum for a coordinated entry written standards specific to our COVID-19 temporary emergency shelter.
Thank you very much, Laura. This is very helpful, and it helps kind of highlight something that we hear a lot about, which is how do people get into the shelter, and actually makes it a little bit easier for the public to understand. So thank you very much for your hard work and your team's work.
Can I
very welcome.
Yes,
so I am actually thrilled to see this moving along, and congratulations to Sarai for actually coming up with what I'm counting as 66 of these beds, which is phenomenal and incredibly hard to pull off. So thank you for your work to do that and make this happen. And I think the referral systems makes a lot of sense to me. The prioritization makes sense. It's, you know, it all sounds good. It's just a quick question around the COVID, the River Avenue clinic and the COVID patients that are there. They're entered. I mean, would they find their way into these beds? I mean, would they be one of the referral agencies?
It could. You know, to state the obvious, we would want people to have finished their isolation period. But, you know, if they were homeless going in, they're going to retain their homeless status, I believe. Lisa Stewart, correct me if I'm wrong, while they're there. And there is no reason why they could not make referrals. I was in communication with Occupy Medical this week about how the people that they are quarantining and having an isolation can access this resource. So I know we're trying to work on that feedback loop right now.
Okay, that sounds great. Thank you.
Yep. And Lisa does say that if people are homeless going into River Avenue, they maintain that status while they're there. Any other thoughts or questions?
Isn't it also just as long as they are not in transitional housing, they maintain their chronic homeless status, whereas if they are in a transitional housing program, they lose their status?
Well, I have to think through this because we're getting HUD technical now. So if somebody, I believe River Avenue would be considered an emergency shelter right now. I'm going to watch the chat to see if Lisa or Amanda can agree with that. It looks like yes. So in an emergency shelter, they are literally homeless. And if that is part of the length of their homelessness, the time for their homeless, then they stay chronically homeless. That counts towards their time. What you're referring to, I think, Chris, is if somebody goes into transitional housing, they lose their chronic homeless status. But if somebody goes into rapid rehousing, they maintain their chronic homeless status.
Excellent. Thank you for that clarification. Yes, Commissioner Farr.
Thank you, Chair McAllister and Laura. You know, the Mental Health Summit meets monthly, and they met this morning. One of the things that that group of professionals works on is diversion from jail. And my question here is kind of a general one right now, as we're talking about homelessness status. In the case of somebody's incarceration for a period of time, whatever period of time, what does that do to their status? You may not be able to answer that at this point in time. But, you know, while we're trying to divert people from jail, alas, people who should be elsewhere are being placed in jail.
I can answer that question if I understood it correctly. So correct me if I'm wrong. But what you're asking is, what does a stay in jail do to somebody's homeless status per HUD? Is that correct? Okay. So jail is considered an institutional setting, which means that if somebody is literally homeless, if they meet the criteria for literally homeless at the time that they enter an institutional setting, they will maintain that status for 90 days. On the 91st day, they lose that status. So if somebody is in jail past 90 days, then they are no longer homeless, which is one of the challenges with the long-term prison systems, is that people are homeless when they go in, they stay in, and when they get out, they don't qualify for the same resources that they may have when they went in. That makes sense.
That does, Lauren. It's good to know that there is some provision for that, but we'll continue to talk about how do we keep people from being sentenced to jail when really something else is what they need, when treatment is what they need. That's an ongoing body of work for us, not necessarily something for this particular committee or for the Poverty and Homelessness Board. However, everybody needs to be aware of it. And the more resources we put into diversion into treatment, the greater the possibility we have of keeping people both off the streets and homelessness and, of course, in housing or out of jail, excuse me. Thank you, Chair McAllister.
Yes, sir. And also just to follow up, it's like, it's not, when we say treatment, that could be mental health treatment, that could be physical treatment. People have different needs that they have when they get out of jail that existed when they went into jail. And so decriminalization of homelessness and things related to homelessness and those interventions, like what we're working on as a community, are very important. So thank you for this vital work. And thank you, Laura, for explaining our technical questions as well as our open-ended ones.
Yeah. I do, if I could, just for a second before we move on, I want to mirror what Mayor Venice said and just say that it's been a very busy year for everybody, and we're really trying to stand up a lot in a very condensed time frame, and we're having to sort of let go of the idea of perfect getting in the way of good. And I just want to say, like, thank you to everybody who is part of this group and to our team. You know, I mean, Steve continues to fight for funding for us. Our team continues to hammer out RFPs and program plans and budgets, and Sarai is out there shopping the resources, and then, you know, you all are checks and balances where we can come and say, are we on the right track or are we not? So I just wanted to say thank you.
Excellent. Well, thanks again. And who is staffing the funding and planning updates?
Chris, just a point of order. We were looking for a vote of approval on this item.
Okay. Okay, excellent. Thank you for bringing that to my attention. I see that at the very end. Is there a motion to approve the coordinated entry approval and standards as described?
I move that we approve the proposed coordinated entry standards.
Second.
That is moved by Mayor Venice, seconded by Commissioner Farr. All in favor, please signify by saying aye. Aye.
Aye.
Thank you.
Excellent. Seeing everybody saying aye, that passes. Is there anything else we need to do with this, Amanda?
Nope, I think that's it. Thanks.
Excellent. Thank you. And so now on to funding and planning updates with Lane County staff. That's a broad topic.
Yeah, I think this was meant to capture a few things, and I think I can get started if that works for others on the staff. I don't know if others have updates. So I will just start with ESG funding, and Laura already kind of touched on several things that we are moving forward with our ESG funds. One being that hotel project that we've stood up, as well as those temporary emergency shelter beds through Shelter Care, and the coming ones from Carry It Forward in January. So those will receive ESG CV funding. The other piece that we have the ball rolling on is street outreach. So we had put out an RFP to add 3 additional FTE street outreach specific to East Lane County and Springfield. So that RFP has closed, and we are finalizing the selection process now. And so that should be rolling out fairly soon. And then the other pieces that we're working on are really in planning stages. So some of the things that we've started to do, we held several stakeholder meetings over the last month, one for family stakeholders, where we were really able to dive into where the gaps are for families in terms of shelter, permanent housing, prevention. So we got some great ideas from there as far as how we can develop concepts for families. And then we also held some youth stakeholder groups, like I mentioned, several different ones. I met with McKinney-Vento liaisons and discussed this, and then had a youth stakeholder meeting, as well as Sarai helped out with managing a youth focus group with some folks from 15th Night. So we were able to get some direct feedback from youth as well. So now we're all kind of taking all that feedback and developing some concepts for shelter for youth as well. And I think there will be additional focus of rapid rehousing for that group also. So we anticipate that we'll be able to really spend all of these funds to serve all of these populations. And we're kind of filling in the small amount of gaps that we have with the leftover funding after we kind of finish out those concepts. So I'm sorry, I don't have a document to kind of overview of all of those things. It's kind of a lot of information, but there's several things moving forward with ESG funding, but we're not at sort of a final stage of at allocation just yet. But a lot of things in the works. In addition to that, we've also been working on several other non-congregate options, one of which is the pallet shelter sites. So we have some things going in Cottage Grove and Florence for winter warming, utilizing the pallet shelters that we've purchased with CRF funds. We're also looking right now to secure some sites in the metro area. Let's see. I think that's it for right now as far as current updates. I don't know if Steve or Lori have anything to add as far as other funding updates.
I don't have other funding updates at the moment. I will just say that we have the first round of pallet shelters was delivered to Florence and I believe Cottage Grove this week, and that is just a huge monumental moment, similar to the non-congregate emergency shelter beds that we had. I believe some will be delivered to Oak Ridge pretty soon. I need to follow up with our team on the logistics of that, and we are continuing to work and negotiate with the city of Eugene to see what and how we may be able to get some there too. So it's a crazy time, but it also is kind of exciting to see us be able to do some things that we haven't been able to do before.
And the other thing I'll mention that I left out under street outreach, we're also going to be RFPing out for some mobile housing navigation services. So those housing navigation services are going to support, one, the city of Eugene rest stops that are being set up. I believe there's 5 different sites for 75 total units. So we'll be providing some housing navigation to those folks, as well as probably a separate RFP to support any additional pallet shelter sites, and as well as the hotel or other temporary shelters that we set up in response to COVID. So the idea of those services is to make sure that folks have case management, making sure they have assistance navigating housing applications, getting on the central wait list, so that folks can, as much as possible, move on to more permanent options after these temporary shelters end up closing, because they are temporary with one-time funding for COVID. So we are doing our best to make sure folks are connected to permanent options as much as possible in all of these interventions. The other piece we hope to add soon that we are working on a concept for is emergency health and mental health services within a street outreach component. So that would be really doing really medical services and triage in the field for emergency health and mental health. So that's still in a concept development, but we should have an RFP out for that sometime in the future as well.
Chair McAllister?
Yes, Commissioner.
Just a brief question regarding the dispersal of pallet shelters. You mentioned Cottage Grove. The small village that's being planned in Cottage Grove on city property also includes a mobile shower unit that the city is purchasing. And at some point, I'd like to talk a great deal more in depth about that, because very affordable, very usable, and very dignified in nature. So I know, Sarai, that we've bought the pallets. We've not done anything about mobile shower units yet, but they are available. And I'm excited to see the one that's going to be delivered very, very soon in Cottage Grove.
Chair.
Oh, yes.
Just a quick, that document that you just had up that had this whole list of projects, do we have access? Have you, where is that contained? Is that on the website, or where do I get to refer to that document?
Oh, I'm so sorry, Maverance. Yeah, so that document is still in a draft form. I didn't realize I was sharing that on the screen. I thought my screen was still on the agenda.
Oh, okay.
Well, we want to make sure the numbers in there are finalized before we're sharing it out, just to make sure it's not super confusing.
Okay.
Some of that is still changing as we get final budgets and develop those concepts. So we do hope to share all of that once it's more final. And
okay. Great. Thank you.
Thank you, Mayor Vitas. Commissioner Farr. Are there any other questions for Amanda and staff regarding funding and planning updates?
Amanda, do you want to mention about the rapid resolution?
Oh, yeah, sure. So we also completed an RFP for rapid resolution services. If you remember, this was, it's really a combination of diversion and rapid exit strategies as part of our TAC recommendations. So we RFP'd that out with funds that were set aside specifically for that purpose, so non-ESG. And we are currently working on the final selection for that as well. So we've selected a service provider, and we're working with them to get that contract going. So that should add several FTE of rapid resolution specialists that will work sort of system-wide at entry and access points for folks that are entering the system or who are more recently entered into the system as the priority, and making sure we are able to divert folks to other housing options outside of our system, since we know we don't have availability of shelter for everyone that needs it. So figuring out other options for folks as we can and having that problem-solving conversation. And we'll also be getting an outside trainer to really train on rapid resolution techniques and specialty, so that hopefully that they will have the adequate training to make sure we're implementing that with best practices. So that is in the works and should be up and running very soon.
So I would mention that we have 66 pallet shelters out of the 120 that have been set up. You know, additionally, the motel that is under contract is 47 rooms. And so the combination of those two things, and I think in Sarai's presentation, she can touch on, we have other challenges going on right now that relate to COVID with sheltering. But we've received a total of $1.5 million from the state of Oregon for out of the cold funds. And that's in addition to these emergency shelter grant funds. And it's really complicated right now doing planning because we're hopeful to charge many expenses to FEMA for some of these activities. And so we've been working with the state to figure out, you know, how can we do sort of a bridge loan kind of concept where we can spend money and then get paid back and notify the state that we have the revenue and reprogram the revenue. Because it is very complicated. But on the other hand, what we want to do is we want to leverage all of this funding that we have for this year and next the best we can. And to Pat's question about, or comment earlier about the vaccine, I've conferred with Dr. Pat this past week, and you know, I think we're going to have to continue to plan for our homeless activities, you know, through the next winter season. And because for sort of a COVID environment, because part of the challenge is going to be how well we can get this population vaccinated once vaccines are available. And then also the prioritization of who among the population will be eligible for vaccines at what time. So that's part of the difficulty in doing the budget planning too, is that we have to make some assumptions that we're going to be spending more money for this year and next year, to accommodate for more of this non-congregate shelter, which it is more expensive, than doing things like rapidly rehousing people and getting people into apartments.
Thank you, Steve. Is there any follow-up or questions to Steve regarding what he just spoke about? Seeing none, thank you, Steve, and for both your information and the staff's support for it. I'd like to, before we go into Sarai Johnson's piece on community current challenges, I'd like to remind anybody who would like to do public comment to please put your name in the chat and let us know that you'd like to speak so we hold space and time for you. With that in mind, Sarai, the floor is yours.
Well, thank you very much, Chair. I have a list of things, and I also plan to write this up in a summary after this conversation. I also want to go relatively quickly with what I have, because I'm sure that I'm not capturing all of the challenges out there, and there may be people who have some info. So one, I'll speak first to Richard's comments in the chat. He asked, are there any plans to test those who are unhoused outside of the congregate shelters? And I have to confess, I'm not certain as to what that looks like right now, but I am happy to ask public health, and I will do that after this meeting. Right quick, I'm going to write a note to do it about testing. And the other question, identifying owners of vacant buildings that could be used for shelter. We are actively working on that. We're working in some level with the EOC or the recovery support function at the city of Eugene as well. They've already done a survey of some sites that they were looking for childcare. So we will probably expand on that, of course, because there are different requirements. But we are looking as much as we can for any place that would be willing or be able to be rented for use for Egan warming. As most of you probably already know, we are limited to 50 people per site. That includes guests as well as volunteers and staff. So that averages out to about 40 guests per site and up to 10 staff or volunteers. We are doing that partly because it's just a better practice in these COVID moments, but also because if we have a major outbreak in one of these shelters and we have more than 50 people, and even 50 is pushing it, to be really honest, that could break the back of our contact tracing mechanism because there would be so many people to have to quarantine, and those quarantines are rolling. So it would be 14 days. Then if someone else in that group popped up with a positive case, and still there was contact going on, we would still have to keep people in quarantine for even longer. So what they're seeing in public health, and sometimes this is true at River Avenue, as well as of other populations, when people are under monitoring and or are fully quarantined because of a confirmed contact, that is sometimes stretching out beyond 14 days to up to 21 to even more than that. So we're trying to make sure that we are not putting extra pressure on public health around this. While that does create challenges, of course, especially around sites, which we were already really not having enough of anyway, even if we were looking at the original kind of what Egan usually does protocols. So many churches are out because they have lots of concerns about COVID-19. We've tried to mitigate those concerns as much as possible by having the county Health and Human Services has offered to pay for cleaning for all of those sites, and have already put out an RFP for that. So we are planning to make sure that any site that's used is fully sanitized, disinfected, cleaned up, so that people can go back and use that site, really as soon as they need to after an activation. So that's a really big one. On those notes, one of the other things that's really been challenging is once we finally had a number of cases pop up in the community of people who are unhoused within a shelter, congregate shelter, we have had to go beyond the capacity at River Avenue pretty significantly. River Avenue can fit between 30 and 40 people, less than 40 right now with its current layout and with the single rooms that we're using, because people aren't bunking together. And so we only have that much space, and we've had to put people into quarantine, I believe around 50-ish people, a little less than that. So that has been really challenging as well, to try to have public health manage all of this in a hotel quarantine situation has also been really untenable for them. They're all working like 7 days a week. And not really having a chance to get by. And this is not a population that they're really well versed in serving. So that's one of the big challenges as well, is how do we support that? We're exploring some different ideas around using some of these pallet shelters that Steve mentioned haven't been placed yet at congregate shelter sites for both quarantine and also really quarantine after a confirmed exposure, and also a quarantine area for people who we can't get their test results right away if they present to a shelter for a place to sleep at night later in the day and public health isn't online. They would have a safe place to sleep for that night until public health could be contacted or people could be sheltered. So that's a really big one. And we're trying really hard to work with public health to figure out how that can work in whatever way possible, so that they don't have to try to take on the service component and we are able to still keep people safe. Other challenges we're having are issues around like land use and around how many people can be on site. If we're looking to place the remainder of these units largely in the metro area, the 66 that Steve said have already been placed are mostly outside of the metro area. Cottage Grove, Florence, Oak Ridge is taking some, Bonita has some, and we're working together with as many other communities as we can to get these properly placed in their areas so that they have better access to non-congregate shelter there. So that has been really great. And at the same time, in the metro area, there's just more restrictions on ordinances and all of that. So we'll probably be looking at scattered sites. And as Laura mentioned earlier, one of the things that we're doing programmatically on this is making sure that there are both site management and navigation services available to people. This is one of the vestiges of my attempt and my desire to try to lead us down the road to make the best investments we possibly can during this emergency so that we can have long-term benefits. This is a chance for us to pilot and test and try a navigation system that is going to be kind of system-wide in its application this time around. And then that will help us get down the road on the programming for the navigation center as well. So I'm excited about that. I think it's going to be a challenge, which leads me to another challenge that we've definitely known about since this all began, which is really provider capacity. And before I say anything else about this, I owe Mayor Venice a public mea culpa on this, that she had asked for a provider survey around capacity way back in September. And I agree that it is absolutely important. I would love to connect with you sometime again to talk about how that should look right now, because it's later. All kinds of things have happened since then, including the burning down of all of McKenzie Valley. So I'm sorry, that's not funny. I'm saying that because I don't know how else to not basically cry about it. So there's all these things. That's also proving to be really difficult on wildfire. So just quickly segueing into that, we have challenges around data sharing with FEMA and Red Cross. Those are starting to be resolved through the state, which is hopeful. We haven't been able to yet get a thorough accounting of how many people and who were displaced by the fire at this point, because there's no data sharing between these emergency response organizations, which is mind-boggling to me. The other piece on this is very much land use. So land use in unincorporated areas is really tricky. The state department that deals with that, DLCD, has made some rule changes. In Lane County, we're very unique because we have zoning that's specific to our county that is not anywhere else in Oregon, or maybe anywhere, who knows, because we're just like that. We're cute unicorns here. So that has been interesting. We're working with our land use folks on this to try to figure out what we can do now and also longer term to make sure that people are able to rebuild, and also what can we do to help temporarily shelter people, house people before they're able to move back upriver, because that's going to depend on the Department of DEQ and also many other layers of bureaucracy that they have to work through. So this is all, big challenges everywhere. Ongoing challenges, we have, of course, this shelter utilization conversation that we brought up a little bit earlier. One of the things that we've been hearing from providers of shelter services is that a lot of families in particular and others have sort of left the congregate shelters I'd say that's very clear in the numbers at dusk to dawn, because that has been a pretty good chunk of people who are exposed there. They also have had to reduce their census again to allow for proper physical distancing on the site. So there's ongoing work on this. But the other reality is many families and individuals don't want to be in a congregate shelter because of COVID concerns. And this is another place where pallet shelters might be able to come in and support some of this a little bit better, where people would be able to have a safe place to sleep, as well as a reliable, set of services that they could rely on, even if they're not sleeping kind of all in the same space. Those are my big ones. Back to you, Chair.
Thank you, Sarai. There's a lot going on there. I appreciate you keeping your head to the path and knowing that it's really hard. And that said, I'd like to just mention as a provider that finding testing is a very hard thing to do right now. And due to staffing shortages at Lane County Behavioral Health, Public Health rather, sorry, wrong letters. But they're having to go outside of that group to try and find testing options. So private sector testing, and that's not as always easy to deploy across a region as it is to do one-offs or with individual providers. So if there's anybody that has options or considerations for streamlining testing or supporting our public health to be able to get more people testing or utilize something from the state, I know that would be helpful. I also know that checking people into hotels when you have no ID is an issue, and I've now found 7 hotels when they found out that homeless people were the possible people taking the rooms, that they were turned down, and they have the right to refuse service. So unless we have some kind of option or hotel capacity, while there's dozens of rooms open, they are not allowed for homeless people. And so that's one of our biggest barriers, I feel, as we move into the next steps. We do have one public comment, and I do have a legislative update at some point. So I see Mayor Venice.
I just wanted to thank Sarai for that. That is it's an exhaustive and exhausting list of challenges that you're facing, and really appreciate what you're trying to do. And we are, given that we are facing these overlapping and ongoing homelessness challenge and COVID and wildfires, that you're able to sort of tease that out and target and navigate through all that and still come up with some solutions is incredibly helpful to us as a community. And it's a heavy burden for you to shoulder. So I really, I applaud your efforts and thank you. And you and I can follow up on the survey on provider capacity. Thanks so much.
I'd also like to say thank you to United Way for helping provide support for both the fire victims and the people experiencing winter needs, knowing that having a community partner who helps find grants and find solutions for our people as we scramble together has been very, very helpful and life-saving. So thank you, Noreen, for your leadership there.
You're welcome. As I've been really quiet today because I'm not feeling well. I did text Chris to let him know. So when you see me off and on with the video, it's not anything personal except for not feeling well. So anyway, thanks for the kudos. It does take a community for us to figure out some of these issues. And to the point I said with Sarai, these are ever evolving situations from week to week, from day to day. The ability to be adaptive and flexible, I think, is probably the #1 competency that we all need to have, because we can't get a fix or control on some of this. It is an ever adaptive kind of environment. So thank you this is the most progress I've heard in such a long time. And I'm just really appreciative of all the work you're doing, Sarai, and all of the team at the county and the city, and all of our providers, quite frankly. It's been pretty remarkable, and I'm just really impressed and pleased and happy to live in this community.
Agreed. And since we mentioned Eugene and County, I want to also give props to the city of Springfield, who has been helping take care of its medically vulnerable by covering hotels, by reforming some of its rules temporarily for the fire victims and RVs, and to really reach out in distribution of life-saving materials such as tents, sleeping bags, and heaters. So with that in mind, we have 7 minutes left. I'd like to give Richard Self the opportunity to speak for a couple minutes. And then before we end, I'd like to mention a couple bills that are being considered by Representative Lively. So Richard, would you like to speak?
Thank you. If you can hear me, I appreciate that very much. I'll be most quick here. I have, according to reputable source, that since the beginning of October, in regards to rent relief money, the county distributed 23% and committed another 25% of 6.6 million. That money has to be returned at the end of the year to the federal government if not used. So I'm curious. Steve just left, unfortunately, so hopefully I can have somebody answer that sometime in the near future. And also, I'm wondering, there was 5 proposed rest stops done by the city some time ago. I'm wondering if there's any progress on that. That's all I have, because I want to hear what Pat Farr has to say, as well as the update from Chris. So thank you.
Would someone like to answer Richard, or should we just follow up? Mayor Venus?
Mr. McAllister, regarding the question on rent relief, I have no response to that. I think Steve Manella may be able to give at least a partial response. So, Mr. Self, let's be in touch apart from this meeting, and I'll get more information to you as I find it.
And as far as the rest stops, I know that Reagan is on this call, and she might be able to give us a more accurate update on where we are in the implementation of those.
Yeah, hi, this is Reagan. Can you hear me?
Mhm.
Okay. Yeah, those the 5 rest stops are underway. We've contracted with community supported shelters, and they're setting up infrastructure, doing site plans, and we expect those to be up by the end of the calendar year.
Thank you. I'd like to follow up at some point and see if we can get them back on board with with HMIS, if they're going to be doing the rest stops, so we can help be part of that bigger picture.
Yes, we expect them to be utilizing HMIS for these.
So, thank you very much, Reagan. Briefly, if the body is okay with this, I'd like to share a couple of concepts that Representative Lively's office is entertaining. One is an adjustment to our state sweeps rules, our dignified, our humane camp cleanup rules. There are some ideas about extending the notification period, having more protections for the stuff that is taken or picked up during a quote unquote sweep or a cleanup of a camp, and treating it with dignity as well as the people. And so I'm excited to hear those concepts as they more flesh out. And I've submitted a concept to consider utilizing our HMIS ID component that is built into the system but not very well used, to possibly be backed by the state as a means to be able to check into a hotel, to cash a check, or to do things that people who are housed and stable are able to do, but cannot as an unhoused person. Sometimes having ID, or even just being able to present who you are, when your insurance knows who you are, when your community knows who you are and have been working with you, but the paper doesn't reflect the actual need. So sometimes we have copies of our ID which does not pass muster for some hotels. Sometimes a copy of your birth certificate is not enough to get your ID, and because of the appointment issues with DMV, because of the COVID shutdowns, and because just straight up discrimination against people with no money but still having the crisis needed, there's an opportunity to explore this on the state level. The only component the hotel says is the state has to back whatever ID is being presented. So if we can maybe tease out that conversation at another time, I'd be happy to have that conversation. Representative Lively, who is also the sponsor of the bill that allowed us to provide birth certificates to folks throughout the state for unhoused people, has been very diligent on trying to help the most underserved of our communities. So I just wanted to recognize that our local legislators are listening and trying to find solutions to work with this community group that we've been talking about. So all hands on deck. Is there anybody else who'd like to speak in the last 2 minutes of this meeting? I think this is the first time we've gone all the way through.
Chair McAllister, if people want to stay behind, I can give a quick update on vaccines. Stephen Null touched on it briefly, but if people want to stay behind, I can give a 90-second update on what Ludke said.
Excellent, thank you. I also want to read what Amanda said in the chat. She received confirmation from public health that ID is not required to be tested for COVID at the public health testing events. Other testing sites require ID to be tested. We have communicated this as a barrier for unhoused individuals. So thank you very much for that update, Amanda. And once again, I'd like to thank everybody on the staff level for making this body and these works happen, and all the electeds and providers who are here giving input and representation of the people they serve. And thank you for the member of the public that spoke and who is also participating in some of the fixes. I look forward to inviting you all to the December. Are we having a December meeting for the PHB?
As far as I know, we are still set to meet unless something comes up that we want to cancel.
Excellent. Then I'd like to invite everybody to the third Thursday of the month in December. I will get the time and we will be sending out an invite. If anybody is not on the invite list that should be, please let us know. Have a great rest of your day and stay well and stay warm. Meeting adjourned.
Thank you, Chris.